Great. Well, thank you all for being here. I really appreciate it. I know that most of you, if not all of you, are in the midst of a busy day and hopefully a busy time for you as we take care of these patients coming out of the pent-up demand from COVID-19. And hopefully the schedules will stay busy and we'll be busy through the end of the year since our fourth quarter is typically our busiest anyway. So I'm hoping that I'll bring some value to you, and then maybe just one idea will help you in your business. And we all know that it's about better outcomes. So that's always the focus. And yet we're going to put our business hats on here and talk about a business concept and, cash services and that type of thing. But the focus is always on better outcomes for our patients. So I'm going to talk about prescribing cash services. Better compliance from our patients leads to better outcomes. And of course, more revenue for our business is part of the reason that we're in business. So again, it always starts with better outcomes. So we never want to forget during this whole talk that you're going to hear about money and cash and all those kinds of things. And yet I've been doing this for almost 29 years. And without good outcomes, it doesn't matter what you're charging or what you're doing or what services you provide or what kind of technology you have in your business. We want to make sure that taking care of our patients is always first and foremost. So this certainly did not come naturally for me. So being, what I consider to be pretty good at prescribing cash services, and you might want to insert the word selling cash services, because when we're in a one-on-one conversation with patients, oftentimes one of us is selling, and sometimes the patients are better at selling to us than we are at actually selling to them, and selling to them what we believe they need, what's necessary for them to get better. Because they trust us, hopefully, and they believe that we're the ones that can guide them to that. So this can be learned. Again, I was probably very bad at this. And maybe if you're younger in practice, the earlier you learn this, the better your practice is going to be. Because it's my contention that at this point in private practice, if you're not good at prescribing and selling cash services, you're maybe not getting the best outcomes you could, and you're definitely leaving money on the table. And we know the insurance companies are, who they are, and they're considered like the enemy in a lot of this. So they're going to do what they're going to do and get theirs. So we have to do the best that we can to take care of our patients and get ours. So a question for you, and we'll wait until the end for you to answer this. So if you were to offer your patients these potential fees for orthotics, the question would be, which number here would be the one that would be chosen the most? So the largest percentage of patients, what number here would they choose? And then what is the lowest one of these three? So I'll be curious to see, and if you want to put it in the chat for Sarah and Ann to take a look at, you certainly can, but we'll circle back to that towards the end, because I'm going to talk a little bit about the psychology of money and the psychology of selling. So there's a great story I heard, and I think it's very instructive here, about a jewelry store owner who was going to be going away for a week, and he had to leave the store to a couple of his associates. And he had some inventory that he wanted to move, and he decided to let the associates do that to keep him busier. And the store was always somewhat busy, but they wanted to move more inventory. So he told them, let's take this extra inventory we have here and let's move it at about 1/3 the normal cost. And they're like, okay, I think we can do that. There should be pretty easy to move that. And, they're kind of busy during this conversation, and, they kind of heard them, but maybe they didn't quite hear what he had to say. So the owner left, came back a week later, and went back into the office and saw that the inventory was all gone. He's like, wow, that's awesome. That must have been pretty easy. 1/3 the cost, people just probably, just snatched it all up. And he realized that his receipts were way over what they were supposed to be based on the amount of inventory. So he was kind of happy about that, but wondering what happened. So he called the associates into the office and said, wonderful that you guys sold the inventory, but we got a lot of money here. What happened? And he said, you sold it for 1/3 the normal cost. And they said, they looked at each other like, oh, we must have really not paid attention. We actually sold it for 3 times the normal cost. It's like, wow, I would have never been able to do that. Like, I'm not that good at sales. So the moral to the story is that sometimes people will buy something for more than you expect. And sometimes there's a better salesperson around than maybe you, the owner, are. And I'm not telling you that you need to have other people in your office selling for you, but this is the psychology of money. These two salespeople never really thought twice about the fact that they could sell this inventory for 3 times the normal cost of it. So I think that's instructive in what we're talking about here. So, so there was a podiatrist that I was talking to about moving, cash services in the business. It was a class 4 laser. We talk sometimes about shockwave, ESWT, or regenerative medicine, which ends up being out of pocket. So anything that's out of pocket. And he said, we have a laser that kind of sits in the corner. It really doesn't do much. And I said, I'm going to give you one word that I think can change things for your business. Stop thinking about selling to your patients and think about prescribing to your patients. Your patients trust you. The 5 of you, there's 5 doctors in the practice. You walk into the treatment rooms with their white coat on. They trust you. They believe in you. And even if they're new, they might have been referred to you by a doctor or another patient. They already come with trust. Prescribe what you believe is necessary. And then his words to me a couple of weeks later was, it's like Star Wars in here. The laser is flying off the shelf and, patients are saying yes to this because we did one thing. We changed our psychology and our paradigm from selling to prescribing. So that's how powerful that can be. And there it is. Prescribe what you believe is best for the patient and forget about what the fee is. Think more about what you're going to be doing to help the patient get better. So these are 2 common questions I get when I do consulting. I've been in a lot of practices, literally from Portland, Oregon to Miami, Florida. Been across the country in offices, consulting, meeting with doctors, meeting with office managers, meeting with staff, finding out, the good, bad, and the ugly in the business, and really helping them grow their business and get better and plug leaks in their bucket. And I know that cash services is one of those things that tends to kind of get pushed off, and a lot of doctors just don't want to broach that subject. So this is one of the questions I get is, how do I get my patients to say yes to cash services? And the second one is, how do I find more patients willing to pay for cash services? So I'm going to just go back for a second here. So how do I get my patients to say yes to cash services? And again, it goes back to prescribe. And I'm going to have a better question that you should be asking, or I feel you should be asking when you're thinking about this. And then how do I find more patients willing to pay for cash services? And, tongue in cheek, I'll say they're certainly not walking around with a dollar sign on their head or something on their chest saying, I'm willing to pay for cash services. The easy answer to this is there's kind of a good and bad to this. They're sitting in your treatment chair already. These patients are already walking into your office. So what you have to do is you have to get, a different paradigm around this and get more comfortable with using the words and the phrases and the things that are going to get people to shake their head, nod their head yes, and be willing to accept the treatment plan that you're prescribing to them. So I think there's a better question to ask than the 2 that I just showed you. How do I confidently prescribe what I believe the patient needs when I know the insurance company doesn't cover it? Because I know in my experience and also in talking with a number of podiatrists that we hold back sometimes services that the patient can benefit from because they have to pay out of pocket. And we're concerned that they're not going to like us, or they're going to go somewhere else, or they're going to say no, which sometimes can hurt. And yet, we're just not doing the patient justice, and we're not doing what's best for the patient and best for our business. So think about this, confidently prescribing what you believe is best for the patient, no matter what. And what are patients really buying? they're buying you. They're not buying the widget. You know, we know that, you know, the laser or the shockwave unit, or, you know, if you're doing toenail fungus with a laser or a regenerative injection that they might have to pay out of pocket. It's not about the widget. It's about you. They're buying someone, hopefully, who has the confidence and belief and the enthusiasm behind that. And this is how money moves. This is why people buy. Again, they don't necessarily buy the product or the service. They're buying the confidence, which also another term for that would be belief, because when you have belief in something, you're going to have more confidence in it. And the enthusiasm of you about what you believe is best for the patient. This is about being authentic and having integrity behind the services that you're providing. And I'm pretty confident that all of you do. We're not just selling them something that isn't going to work and that we're just trying to take their money. But oftentimes it can come down to not really having the confidence belief that, you know, this particular piece of technology, and again, I'll talk about, you know, class 4 laser and ESWT, because those are the most common pieces of technology that we're prescribing for patients on a cash basis. You know, do you really have the belief and confidence that that technology is going to help your patient? And, you know, if it's new to you, then you're going to have to maybe borrow that confidence belief from other people who have done it successfully. And I know from personal experience that those two pieces of technology work very well. Do they work for everybody? Absolutely not. And that's where expectations with patients is very, very important. And you can hear my enthusiasm, and I'm enthusiastic about practice management, about this particular topic. And when I talk to patients, this is how I talk to patients. Like, I know that this particular piece of technology can help you. And the last thing I want to do is surgery on you if I know that something else has as good, if not a better chance to get you better without the risks and the time and the money involved with surgery. So, you know, doing it enthusiastically is a big part of getting the patient to say yes to something that's going to benefit them. So I want to dispel a common belief that people have. And, you know, this is really, really important because I hear this all the time. You know, my patients are different, and in my area, it's different. In my business, it's different. And it's not. Your business and your patients aren't any different than anywhere else. If I can sell prescribed cash services every single day to patients in Milwaukee, Wisconsin, you know, blue collar, certainly there's some affluence and there's certainly some, you know, that are on the poorer side, but certainly, you know, pretty much right down the middle, blue collar, anybody can in any particular area. And yes, of course, there are some people that can't afford it. However, there's many people who you think can't afford it are willing to afford it because they believe the value, they see your confidence, your belief, and your enthusiasm behind it. So this whole thing about my business is different and my patients are different and all that, I'm sorry, but it's not true. And I heard that from one of my mentors, Dan Kennedy, and I hear it all the time when he talks because he gets this all the time from business owners. Yeah, but Dan, my patients or my customers or my clients are different and all of that. And they aren't willing to buy things and all of that. And they're out there spending dumb money on a bunch of things. So I think it's good money they're spending on the things that we're doing. So you've got to like move that thought process out and move a different thought process and paradigm in if you want to be more successful at prescribing cash services. And by the way, I'm not recommending that you turn your practice into an entire cash business. You could try it. I think it might be suicide to your business. I'm not going to do that. It's just a piece of the business, and I want it to be a growing piece of the business because I don't want to have to rely on insurance companies, because with a stroke of a pen, they can change things on us. And before you know it, they're not covering whatever. And I don't want to jinx us, but you know, those things happen. We all know it. I've been around long enough to know that the more that I can increase the cash revenue in my business, the more that you can increase the cash revenue in your business, the more security you have, the better you can sleep at night. And I do like to sleep. Fears and false assumptions. So about like prescribing cash services, doing cash services, maybe having fees that are higher than other people is I can't violate industry norms. What in the heck are industry norms? I don't ever think about industry norms. The only norm is my norm, what's going on in my walls. I live in a bubble. So, my fees are probably higher than most people. And I like it that way because I know the value of what I'm providing to my patients. And you know what? Oftentimes they think the value is higher than what I'm actually offering them from a cash basis. So there are no norms, just because someone else down the street or, some magazine in podiatry or some blog says that we're doing it this way or we're doing it that way. I say that's hogwash. Just come up with your own norms. Now, of course, we want to do it on an evidence-based method, but at the same time, I have my own norms. I know what works for me, and some of it can be anecdotal, and that's perfectly okay. I know that I'm doing the right thing for the patient. I'm doing it ethically with integrity. I feel good about that. So it's harder to attract patients when fees are higher, and that's not necessarily true. So, the orthotic question that I asked about the fees there, it's not harder to attract people because fees are higher. In fact, sometimes it's easier to attract patients when fees are higher because some people don't want to go for the low price leader. And by the way, being Walmart and being the low price leader works for one company. It's Walmart. It doesn't work for anybody else. So I'd rather be the high price leader. You're going to lose patients. No, you're not going to lose patients. Somebody might say no and decide that they don't want to come. But in general, again, if you're doing this the right way and you're following what I'm talking about here, you're not going to lose patients by offering them cash services. By the way, you can let them know that there's a surgical procedure for this as well. And I do surgery, and surgery does work. However, I have found that doing this with this particular piece of technology works 80 to 90% of the time. And the vast majority of people don't need surgery. And that's where patients will be like, okay, I like that. I have that to fall back on. And I'll even let them know, by the way, your insurance company is going to cover that. And if you want to go in that direction, I'm okay with it. I'm just letting you know the options here. And I believe that this is a better option for you. And you can decide. And the vast, vast majority of them are going to decide on the cash service. So there's a false assumption that many patients are price shoppers. They're really not. I mean, we don't really have prices that are out front, like grocery stores and, other stores and things like that. Patients don't really know what our fees are. So patients aren't necessarily calling. Once in a blue moon, someone's going to call and say, how much are your orthotics? Or I'm paying cash out of pocket. How much do you charge for a nail corrective procedure or something like that? So, there just aren't that many people that are price shoppers in our industry. I'm being greedy by charging more. Well, that just comes down to your beliefs. I don't believe that I'm ever gouging anybody. I'm not charging them thousands of dollars for something. I mean, if I was charging $10,000 for a shockwave, that would be a whole nother ballgame. But I think the fees are very reasonable. And again, there's many times when patients would say to me, wow, I thought that was going to be $2,000 when, it might be, $597 or $997 or something like that, because patients often have a perception of medical things being fairly expensive. And, that's something we should kind of take advantage of in a good way without being greedy about it. The perception of value often is higher from the person sitting in the treatment chair than it is the doctor in the white coat. And why is that? We're just in an industry where we're so used to third-party payers, but we don't have to talk about that. Those days are well gone, and we really need to move into a different mindset about this. And then I know, and this is you, the doctor, I know they probably can't afford that. We're prejudging what we believe people can afford. And yet, they may not seem like they have money and they're walking in with, a Michael Kors or a Louis Vuitton or something like that. And it's like, well, okay, well, maybe there is some money there. So the fact of the matter is your patients are constantly spending money, and some of it is dumb money. I just spent about $2,500 on some golf equipment. And I can tell you there's probably plenty of people on this call, including maybe Sarah and Ann, who think that's dumb money. And they would probably buy some shoes and boots and things like that. I can say that because I got a lot of women here that love to buy shoes and boots in my practice. I would say that's dumb money. But it's all in the eye of the beholder, right? Where is the value? It's in the eye of the beholder. So, but our patients are spending money constantly on things. And, you're thinking like they're not going to spend money on something. And all of a sudden, they're out, getting pedicures and, spending money on their hair every week or whatever. And that's just not gals. It's just not gals. It's guys as well. So we have our dumb money things that we like to spend things on. So it's important to know that because people are spending money all the time. So here's a really, really important concept. The person thinking most about the money in the treatment room is who? It isn't your patient. Your patient's really not thinking about money all that much. Again, most of the patients aren't thinking about them. They're thinking about wanting to get better. They're thinking about value. And yet us, the doctors, and again, me at one point in my career, and likely many of you, you're the one thinking about the money. You're focused on the money. I don't want to talk about the money. And what if this doesn't work? And I don't have that thought in my head. You know what? I over deliver. I provide more value if something's not working. I do whatever I can. Maybe I give them a couple of extra laser treatments. Maybe I give them an extra shockwave treatment. And, I nurture them through the process. And once they've paid for that service, and they pay up front, because we don't like the, just stringing them along too much. We do have a payment plan. I'll talk about that. They're not thinking about it anymore. They're thinking about getting better. Maybe you're thinking about it, but they're not. And you're concerned about like, what if they don't get better? Are they not going to like me? Are they going to ask for money back? And I can honestly tell you that I don't remember the last time somebody asked for money back for laser, shockwave, orthotics, regenerative medicine, things that I provided for them that maybe didn't work as well as we had both hoped. According to research, only 10% of buyers use price as the top 3 criteria for making a purchase. So that should be really, really instructive to everyone because we think that buyers are buying mostly on price. And just think about yourself. Are you always buying on price? I went to buy golf clubs. I was buying on value. I was buying on name, brand, and maybe, someone on the tour that, I like and who, hits the ball well. And I like the way the club looks in his hand. That's just one example. It really didn't have much to do with price. And that's the way this is, again, research that has been done on thousands and tens of thousands, if not hundreds of thousands of people, that only 10% of buyers are thinking about that. They're thinking about many other things. I just mentioned other things that I'm thinking about. I'm thinking about, the tour player that has it. I'm thinking about the brand name. I'm thinking about the value. I'm thinking about how it looks in my hand. All those things are important to me before I even get to what is the cost. Now, I'm not willing to spend tens of thousands of dollars. At the same time, I'm willing to spend probably more because those things have met like my criteria. So it's important to know that when you're talking to patients about cash services, because again, very few of them are thinking about the money. They're thinking about other things that are important to them. So how do we create a cash culture in our business? Because it's important that if you, the doctor, are going to offer cash services to your patients, offer more cash services to your patients after this, maybe, it's important that everybody in the office is aware of what we're doing because it can't just be incumbent upon you. Now, you are the one, in my opinion, that should be offering those services, that should be prescribing those, because that's what we do. We prescribe, right? And you should be the one doing it, not your medical assistant trying to train somebody else. They're not going to be good at answering the questions that are going to come up from patients. Now, when you step out of the room, they might need to answer some questions, and that's where training is important. But you first, like you're the first one. You're the leader of this cash culture that you're creating in your business. Every team member needs to know this is what we're doing. These are the fees. These are why we're doing it. What is this piece of technology? A couple things about what it does, the fees that are attached to it. Why is that fee attached to it that way? Because you never know. Again, questions are going to come up that you're not necessarily going to be part of in those conversations. So you want everybody to be aware of that. You want your medical assistant to look someone in the eye and say, after you had said it, that yes, it's $497 for this or $597 for that, or $997 for 4 shockwave treatments, whatever your cash fees are. You want your team members comfortable with that. They don't have to sell anything. All they have to do is echo what you've said to the patient. And at the front desk, of course, collecting money, right? So, part of a cash culture is we have to prescribe it and then we have to actually collect it. We got to make sure that, we're getting credit card or whatever. written agreements are very, very important. So, we want to make sure that the patient is signing something. This is the agreement. And that's where getting money up front is really critical, because we don't want to have to chase this. This is one of the big benefits of cash services, is that we don't have to have our billing department or collection department chasing patients for these things. The credit card now is golden in our business. Patients just swipe it and away they go, or they use their HSA or FSA or that type of thing, which, again, a little pearl for you is to include that on your intake form. I'm looking at that all the time with a new patient. Do they have an HSA? Do they have an FSA? It's an easier conversation conversations with patients when you know that, because oftentimes patients will use that. So it's a lot easier when they don't feel like it's really coming out of their pocket. It's something that they've earned from the work that they're doing. And then payment plans, we do have that. We don't offer that up front, but I would say that maybe about 10 to 15% of our patients are asking, can I make payments on that? And we have a 3-payment plan. They're making a 3rd payment on the initial service. They're making a 3rd a month later, and they're making a 3rd a month after that. By the way, we have their credit card on file. And, for the most part, and I can't say never, but for the most part, we don't get stiffed on that. Patients are willing to do it. And fortunately, a lot of them are getting better, so they're more willing to make that payment if they're on a payment plan. And then here's something really, really important to avoid. It's the sales prevention department, okay? So who can be part of the sales prevention department? Well, I just had a podiatrist, someone from an office said that the doctor is the leader of the sales prevention department, because he doesn't want to offer cash services and the things in the practice that can benefit the patients and benefit the practice, because he's just uncomfortable doing it. So he is the leader of that. We don't ever want the doctor to be the leader of the sales prevention department, by the way. We can have other people that if anybody's going to be it should be somebody else, but hopefully nobody. And if you really create the right cash culture, no one is in the sales prevention department. The last thing you want is for a medical assistant to come in behind you after you have prescribed what you believe works, and have that person say to the patient, well, you can go get some Superfeed inserts for like $40, and I found out they work pretty well. That's a killer, right? That's the sales preventer for your business. So you have to make sure that no one in your practice is part of that department. So here's 3 really effective phrases that I use almost every time that I prescribe cash services. And I've talked to other podiatrists who have adopted these, and whether 1, 2, or 3 have worked for them, 1 for sure has. And, it's easy to just keep using them when they work. So this is a term that I use, and I would highly recommend that you use. What I found works best is, and that's based on my experience, what has worked best for me in the practice, why I would recommend ESWT over an EPF, the benefits of that, all those things. So when you have the white coat on, and hopefully that trust of the patient and the confidence from the patient, saying these words mean a lot. What I found works best. And when you're young in practice, same thing. You just have to say it with confidence, because you've been in residency, you've been around doctors, you should borrow the experience that other people have to say those words. And then over time, you'll be able to see for yourself. But these words are really, really effective. And then attached to the end of that, whatever you have found works best. Here's another one. Fortunately, it's not $1,000 or not thousands of dollars, because some things that are cash can be $1,000. So for instance, if I'm talking about orthotics, I'll say, all the things that I say about the value of that. And at the end of that, I'll show you kind of the script that I'll use for it, for cash conversations, which I think can benefit you. But I'll say, fortunately, it's not $1,000. And then I'll tell them what the fee is in our practice for orthotics. And they immediately have kind of this energy shift where they kind of drop their shoulders, because again, people are often perceiving that medical fees are higher than what we charge, and they have more, sometimes they attach more value to it. So, they have this energy shift of, oh, wow, thankfully. And then they're like, oh, that's not so bad. Now, if you did the opposite of that, it would be more difficult for them to have that energy shift and be happy about the actual fee. So if it's something that I'm charging for, say, $997, I'll say, fortunately, it's not thousands of dollars. It's this, for this many treatments. Now remember, at the top of all of that, they've gotten the reasons why, the value behind it, the benefits, the consequences of not doing it. and the cash part always comes last. And then the last one here is, I'm recommending this because, and you come up with your becauses. The becauses are the benefits to you. The becauses are there's consequences to not doing something. But this one word has been studied. Psychologists have done research on this, and this word has been effective. Just putting that word in front of the words that you want to say can make a difference. So take advantage of these 3 phrases that can work very, very well. By the way, I didn't come up with these. These are things that I've studied over time, learned these things, adopted them into my practice, found that they worked, and now they just roll off my tongue when I'm having conversations with people. Another thing that can be really beneficial to prescribing cash services more effectively is we have the opportunity to demonstrate to patients and dynamically demonstrate to patients why we're recommending something. So we have x-rays. Patients like diagnostics. They come in and they prefer to get as much diagnostics as you possibly can give them. Now, they have high deductible. We know that they're going to be asking questions. How much does that cost? But let's assume that that's not there, that we have tools at our disposal to really help get the patient to understand and get us to understand the correct diagnosis, right? So we have all of these different things that we can be doing. And I don't remember the last time a patient said no to an MRI. I mean, they want that. They want a diagnostic, especially if you've done a couple of things that haven't worked and you're realizing that maybe I just don't have the right diagnosis here. Let's get an MRI. They're nodding like, yeah, let's do that. That's great. And we have these things now. So, if I'm going to do a shockwave, for instance, and, I've done some things that I traditionally do for plantar fasciitis that are not working, I'll get an MRI before I do the shockwave because, what if there's bone marrow edema or something there where the shockwave would be contraindicated? I certainly don't want to do that. I don't want patients paying for something when I really don't have the correct diagnosis. So, in our business, it's very easy to make diagnoses based on history and physical exam. And I've had many patients say they've been to a podiatrist or 3 before they came to me. None of them took an x-ray for something that, it was a, likely a bone or joint condition. And maybe the x-ray showed nothing, but the patient's more comfortable, that it's more trust in you because you've taken that extra step. So I don't take these for granted. They really are dynamic to the patient, and they really demonstrate to both you and the patient that we're on the right track here, and this really is the right thing to be doing for this particular cash service. So preparing a sales script, something that we don't think about in podiatry, and yet we're in these conversations every single day, whether it's something that's covered by insurance or not. You're trying to, quote unquote, prescribe a bunion surgery for a patient, someone who you really believe would benefit from it, and they're coming in with pain, and they're maybe sitting on the fence. I don't ever push anybody off the fence, but I'll give them my insight. It's the same conversation as when we're talking about cash services. So think of it from that perspective and not just think about it from a cash basis. But here's what I typically do. I'll talk about the history of whatever it is, the history of class 4 laser. Now, this is not a long-winded conversation. I see patients in 15 minutes and I can get all these things done, the exam and all those things, and this in 15 minutes in most cases. So this doesn't have to be a long-winded thing. I'm not someone who tells them everything they need to know, because most people don't really listen to most of the things or hear most of the things you say. So give them a little bit of history behind what it is. What is the history behind ESWT? What's the history behind regenerative medicine? The orthotics, maybe not so much, but maybe a little bit about that. What the service does. So just in a nutshell, like your elevator speech about what this service does, so that they know what the service does. And then pertinence to podiatry, because maybe, for instance, shockwave and class 4 laser are used all over the body. So what is the pertinence of this particular technology? Like shockwave, of course, started with, the gallbladder, the gallstones and that type of thing. So you want to let them know what the pertinence is to our profession. Benefits, benefits, benefits. It's really important that they know the benefits of this. It's not just to get you out of pain, but listen to them. I want to be able to go on vacation and hike. So one of the benefits of this is that when this pain is gone, you're going to be able to go on vacation and hike, and you're going to be able to go to Disney with your family whenever everybody's not wearing masks at Disney, or whatever the patient wants. So benefits are extremely important. the protocol. So what are you going to do? We're going to do 2 treatments a week for 3 weeks. That's the class 4 laser protocol. I'm going to give you this particular regenerative injection. We're going to cast you for orthotics, and they're going to come back in 2, 3, 4 weeks. We're going to fit you for them, explain how to break them in. Whatever the protocol is to what you're prescribing, it's important that they know that. Expectation is critical, right? We don't want to say, this works every time, this is fantastic, all those words that sound very salesy. I want the patient to know what the expectation is. Now, I don't want to be a Debbie Downer, just let them know that the vast majority of people do well. The success rate with this particular technology is 85%, whatever that number is. And I always tell them, yes, some people don't get better. And, oftentimes patients, kind of have this negative, I'm probably going to be in that 10 to 15%. And I try to help them think more positive about that. But expectations are very, very important. And then you can see where fee lands here, right? It's not at the top. We don't want to let them know, because then they're only thinking about money and not thinking about all the other things that will bring value to them. So the fee is always the last part of it. In any sales conversation, a good salesperson, and for us, a good prescriber, should be using the fee at the very end. Okay, so your most effective path to successfully prescribing cash services is to become an authority. And we already are. We wear the white coat. We already have some authority with patients, but we want to be able to increase that authority. And authority is everything. I mean, authority is what can sell just about anything. And again, we do it with integrity and being authentic about doing it. So how to be an authority? Wear a white coat. I mean, it's just my belief and my philosophy. I've worn one pretty much every day in my business. If you're not wearing a white coat and you're able to do what you're doing, it's perfectly fine. Research has shown that white coats can make a difference. I'm not telling you how to practice, just something to consider. A choreographed appointment. Important, right? You don't want them coming into chaos and, the doctor and the medical assistant coming in and out of the room, and at the front desk, it's unorganized and the reception room doesn't look clean and organized. And, take the patient through a choreographed appointment. I don't know if anybody has seen the movie The Founder about Ray Kroc and McDonald's, and they did a scene on a tennis court. They wiped off the lines and they created what goes on inside McDonald's and had them choreograph exactly the movements that they do, from the French fries to the hamburgers to the malts to everything else, and really kind of put them through their paces way back in the day. And that's how they run McDonald's now with 15-year-olds and 18-year-olds and whatever. So the choreographed appointment is extremely important. What happens when the patient walks into the door? What does the medical assistant say? What happens when the doctor walks into the room? How do you close the appointment? Is a follow-up appointment being made in the room or at the front desk? How are cash services being paid? Is the technology available to, bring into the room right away if you're doing it on the spot? So choreographed appointments are really important. Exceptional experience kind of goes along with this. The look of your place, the look of your staff, the words that are used, all those things are really, really important. People go back to Chick-fil-A not just for the food, but because they get great customer service. They say, "My pleasure." After everything, you say, "Thank you." They say, "My pleasure." And that's just kind of the way it is. People will come and stay and refer for the experience. And then how else can we become an authority? Articles, blogs, speaking engagements, books. I mean, all the different things that you can have out there so that patients can see that you are an authority, that you're writing about things, and that you're speaking at, in front of nurses or groups or things like that. And, it's easy now to write a book at a pretty low expense to have in your practice, because you even look like more of an authority when you have something like that. I'm not talking about, a large, book like that. This is not, a textbook type of thing. This is a small little book that we have in our business so that patients can see that we are an authority and that we like to write things. So little things can make you an authority. Tie all these things together, being a leader worth following. And that just comes down to how all these top things are being done in your business. And higher fees actually oftentimes can equal more authority. There are people that attach that to an authority. Some people, and there's a certain percentage of the population, like to go to people that are charging more because they perceive that, there's more value there. There's an authority there. There's more experience there. There's more skill there. So that's part of the reason why I want my fees to be a little bit higher. I believe in myself, but also I want the patients that, really think that way to be attracted to the practice. So there's two big outcomes of authority. Credibility, absolutely critical. It's so much easier to have patients nod their head yes to cash services when there's credibility behind it. And then the trust factor, obviously we know how important that is. I don't take these two things for granted. I do whatever I can to increase these two things with patients with all the things that I mentioned on the last slide. So I want to give you an example to think about, and you can put whatever numbers you want in your business. This is something I'm thinking about or have thought about and I'm working on in my business. So how to build a $91,724 cash profit center in your business. Again, attach whatever numbers. If you're not doing much cash now, maybe 25,000. If you're doing cash services, maybe 200,000. But this is just with one particular technology. This is not for everything in the business. I think about this with one, and I think about it with the next technology and the next technology or the next service. So it's pretty easy to have one conversation every day with patients about a particular cash service. And if we're seeing patients 4 days a week, that's 4 conversations per week, right? I mean, if we see 25 to 30 patients a day or 20 to 25 patients a day, it shouldn't be that difficult for us to have one cash conversation with them. And if we can convert just 2 of them per week, and if you get really good, you can convert 4 of them per week, 4 out of 4. And maybe you're having more than one conversation, but let's just say that 50% of them say yes to the cash service. And your cash service is $997 for whatever that may be. I do have a cash service for technology where I charge $997 for that. And again, there's 2 conversions per week. So per week, it's $1,994, pretty good. Now, we extrapolate that out to the year, and let's say that we're working 46 weeks out of the year. You can decide what numbers you want to input here, but this is what's possible when you really break it down, and I call it reverse engineer. And I would highly recommend, encourage you to come up with a number that you like, that looks good to your business, that's going to motivate you to get better at this, and then reverse engineer it. And just think about one conversation per day for orthotics, one conversation per day for class 4 laser, one conversation per day for ESWT if you have that in your business. And just each one of those things, if you're having one conversation for each one of those things, look at how bigger the numbers can be for your business. It doesn't take a lot, and don't get caught up and lost in, I can't do $991,000 in cash in my business. Well, if you break it down this way and your fees are maybe a little bit more than, the quote unquote norm, then you can, and again, plug in whatever numbers you want here. So there's many benefits of prescribing cash services. Better compliance. When patients have skin in the game and they're paying out of pocket, they're going to be more compliant. We all know that when that other guy, the insurance company, is paying for it, it's kind of a different ball game, right? Maybe I'll do it, maybe I won't. But when there's skin in the game, oftentimes patients are actually more compliant. They're going to show up for their appointments. They're going to use that night splint. They're going to do whatever they can to get better because there's money out of their pocket. Better outcomes come from better compliance, right? And when they have skin in the game, typically there can be better outcomes to that. There's more referrals because they're happier. The patient is better. They're happy with the service. They're happy with you. And they're going to refer more to you. Increased revenue, okay? I call it now money. Now money is, we can start that today. So we'll talk about ESWT. These are the reasons why. By the way, if you want to have your first treatment today, we can do your first treatment today. They do the treatment, they walk up front, they pay for the entire package, so to speak. They come back weekly times 4, and that's the protocol. So who doesn't love now money, right? The other thing is like future money, which is like chasing money in most cases. We all hate that. less stress on the staff because, again, it's now money. Like their credit card's done and the billing department's happy and we're not chasing people for money. And the staff at the front desk doesn't constantly have to look the patient in the eye and say, by the way, Mrs. Johnson, you owe $500 for that. More security from, of course, insurance changes and things like that. The more cash services we do in our business, the more security we have. And of course, all of this comes with better sleep. So the perfect marriage is effective services plus confident offerings. Confident offerings, really important word. And we know that these services are effective. All the things that I mentioned, if there's other ones that you do in your business, fantastic. Pair those two together, better outcomes for the patients and more revenue for the business. So the answer to the question, $497 is the number one that people would choose. It's the middle one is typically the one that people would choose. So if you weren't here at the beginning, I put up what number would most people pick if we offered them orthotic fees of $497, $597, and $397. And the number one is always the middle one. The vast majority of people, there's a large percentage of people that pick $497. And then $597, not $397. We all think it's the lowest one, and that's not necessarily true. So 5 to 20% will always choose the highest no matter what. And in your patients, just like any other patient list, there are between 5 and 20% of the patients that are willing to pay the highest for just about anything that you offer. They're willing to get that second or third pair of orthotics. They're willing to just go above and beyond because they perceive it as being value. And some people would call it dumb money. They would call it valuable money. And then $397 is typically the one that's chosen the least. $597 and $397 are not far from each other, but there's always going to be some people that are willing to choose the highest one. So with that, Sarah and Ann, I feel like I'm long-winded. I hope that wasn't too long. I hope I brought value. Maybe there's some questions. I'm more than happy to hang around and answer them, and I will end show.
Okay, no, that's fantastic. Thank you so much. We have a couple things coming in the chat, so let's click on those and see what we've got.
All right, chat. Dr. Sharif answered your question about what he charges for custom orthotics. He says he charges $395.
Okay. Yep.
So that was kind of right in the middle of your prices, right? Yeah.
Actually, the lowest of the three.
Oh, okay.
Gotcha.
And Dr. Shapiro said thank you, of course.
So right now we've just got some kudos, just thank you and great presentation. So this is a good opportunity for anybody who's on the webinar to go ahead and type in your questions for Dr. Milkie. And again, if you would like to ask your question in person with your own voice, you can certainly do so. Just use your raise hand icon and we will unmute you and get that taken care of. So we're going to sit tight here for a second and see if any questions come through.
They might all be running off, offering cash services to their patients.
That's right. Everyone's out there typing up their new ebook.
Yeah. So Dr. Sharif says, do you suggest we raise our orthotics price?
Well, I don't like to make those suggestions. I mean, my opinion is that I charge $497. I'll just be right out there and say it. So that's been our fee, and I was at $325 back several years ago, and just kept on inching it up. And I'll just base it on research. If you're anywhere under, let's say, $497, and there's a reason behind the 7. That's been studied as well. 9 is not a good ending number, just for whatever reason, people didn't pick that. 5, because we've seen like $995, right? That's been there as well. But 7 is the number. There's some psychology to 7. So everything in my practice is $397, $497, $597, $997, $1497. We just have that there. So that works. But research has shown that if you're beyond a certain point, you can go to the next level. And for instance, if you're at like 350, you could go just to under 500 and be fine, and find that people are willing to say yes to that. So I would say, and this is what I've suggested to a number of people, and they all said, fantastic, it worked, is if you're at a number like a 350, I would say at the very least go to 397, just test that. Go to the end of that 3 number, and you will find probably zero pushback from that. And it all comes down to testing, right? And then you kind of have to get over the hurdle of going beyond 397 into the 4 range if you ever decide to do that. But I'm not telling anybody here to, do anything, but that's just kind of the psychology behind that. You can easily, I've had people go from 450 to 497, blink of an eye, no problem. Patients accepted it. And again, it really comes down to your confidence, belief, and enthusiasm behind it.
So another question came through. What have you found to be the best cash service you have brought into your office in the last 2 years? And by the way, my orthotic price is $450.
So 450, great. I would say you might want to consider testing 497. It's just easy money there sitting on the table, and you're still going to be providing a great service to the patients. So in the last 2 years, actually, I brought in the Remy Class 4 laser. So I've been looking at laser. I've actually had a good friend who had a laser in his business for a decent while and used it all over the body. He's an MD and just saw the value of that. And, just realized that we had multiple doctors in the business and that we could all be using this. I mean, even if I used it myself, I knew I had plenty of opportunity for that. So it's been great. Patients really, it works. I mean, patients are getting better. Patients love it because they're getting better. We always say this thing like, patients love it. Well, patients love it because they're getting better. I love it because patients are getting better, and it's a wonderful, it's wonderful cash revenue for the business.
Awesome. I have a question, just because I think it's interesting. So you were talking about just patient types, and no, all the patients are the same. That it's not about, well, my patients wouldn't do this and your patients do this. What is do you have a standard patient type that comes into your office or that you target via marketing? Because I'm just interested to know how you get your ideal patient in your door.
Yeah. Well, the answer to that is absolutely. I mean, I know exactly who I'm looking to attract with all of the marketing that I do. Whether it's, email marketing, direct mail marketing, website, not so much because that can take all comers. But everything else is centered around, for my business, it's the 40 to 60-year-old female. It just seems to be the right target. They have the most foot conditions. They have kids, they have parents, they're good referrers. So that's really who I'm looking to target. Someone, of course, who, could be working or at least has a spouse working, and, there's insurance there, and I don't need affluence, but, someone who understands value, who, puts a high priority on health. They're not just there like, I want my foot to get better, but I want to be able to exercise. I want to be able to do these things. That's important as well. So I want to be able to definitely write about those things and speak those things, because I believe that when your marketing is effective, as you know, Sarah, because you have 10 toes marketing and you know a lot about marketing, that, we really want to hone in and who is our avatar. That's really what I focus on. Now, we'll take all comers, but at the same time, I want to make sure that, 75 to 80% of my patients are the ones that I really want to see.
How much do you rely on physician referrals over people coming in your practice based on your own marketing efforts and patient? So separating patient referrals and marketing from physician referrals.
Sure. I absolutely love physician referrals, but that has changed. I mean, it's certainly changed here, and I know it's changed across the country, and some areas are different than others, but in most parts of the country, the independent, internist, family practitioner no longer exists, or exists in very small numbers. So at one point in our business, we were up to our highest month ever was 120 new patients from MD referrals. That number has dropped significantly because they're all working for corporate medicine, and all those corporate systems have podiatrists. So now they have to refer down the hall. They used to refer down the street. Now they have to refer down the hall. So I love MD referrals, and we still get them, and we still nurture those relationships. Pediatricians are still pretty much fair game because many of them are still independent. So we get a fair number of referrals from internists, but you've got to morph yourself in your business from a marketing perspective, and I can't rely on 120 new patients from MD referrals, so I have to figure out other ways to bring them in. And, we look at physical therapists and urgent care centers and pediatricians, as I mentioned. So we're still trying to do what we can, but those numbers are a lot lower now.
That makes sense. Okay. Any other questions coming in? Seeing me at the moment.
We'll give it one more minute, but I just want to say thank you to Dr. Milkie for taking the time to do this for us. It was definitely a wonderful presentation. I really appreciate any kind of lecture that gives you exact phrases and tactical tips that you can implement right now. And so, I'm thrilled that you were able to present that to all the physicians. And if you aren't able to catch the webinar live, or if you'd like to rewatch it later on this evening, it will be posted on demand on the webinars page of the podiatryexpo.com. So you can watch it there. And
yeah, and by the way, if I may, if you have an associate in the business, staff in the business, this would be wonderful for them to see.
Right.
Moving the needle a little bit with the people around you, especially an associate, because, they're having the same conversations with patients as you are. So,
Exactly.
just multiply what you're doing from this perspective. And I'm a big believer in a whiteboard and having those phrases on a whiteboard, or, the technology in front of you, knowing where your protocol is. I had one podiatrist who was doing very few orthotics when I went out to do a consultation at his practice in Portland, Oregon. He really wasn't doing any orthotics, and he put on his board the code, which is L3000 for orthotics. And he said immediately he was able to do 5 more orthotics the next week. So, just think about that. And then, as long as that stays up on the board, it'll be front and center when he walks into his office. So I love whiteboarding. I have whiteboards in multiple places in my office. I use it with staff. It's just really effective for this type of thing when you're learning something new.
Well, anything. I'm always just like, just write it down, because I'll just remember it. I'll remember it. You won't. You're not going to remember it. Write it down. Anything. So yeah, I live by that for sure. What's that?
Put it on your mirror.
I have a dry erase on my mirror for like when I need to get motivated, or if I'm feeling like gross one day. I'm just like, okay, you need to write some sort of nice affirmation. Absolutely. Awesome. Well, I think that's going to wrap up our time. Thank you so much. Anyone, if you're interested in speaking with Dr. Milkie about his consulting services, you can contact him. You can go to Podiatry Success, and we definitely recommend that. So
yeah, and you can email us too, and we'll connect the two of you if for some reason you can't,
figure it out.
Yes.
You can go to chris@podiatrysuccesstoday.com. Chris, CHRIS at Podiatry, or contact you guys, however you want to do that.
Awesome.
It'd be great. Thank you so much for having me. I really appreciate it. It was an honor. Again, I hope that podiatrists just go and start doing this stuff. It works.
Awesome.
Awesome.
All
Great.
right. Thanks,
Thank you very
everyone.
much.
We'll see you soon.
Take care. Bye-bye.